So, anonymous, how are the expected outcomes to be phrased? Yes, I indicated in the proposal, abstract of the proposal, we need to indicate expected outcomes. So it depends on the objective of the study, but it is not a restatement of the objective. It is what you expect at the end of the day. It has everything to do with the hypothesis you've set or the research question you want to answer. What answers are you going to be able to provide or are expecting to provide at the end of the research? You don't have results, and therefore you cannot state categorically. So it should be phrased in a way that is futuristic, more optimistic, that the study expects to determine the relationship between this and that, and therefore will be able to improve clinical practice and reduce delays among healthcare seekers. I believe that is okay. What does conceptual framework in the introduction mean? Doesn't the proposal have a literature review? Conceptual framework is not literature review. It's different from the literature review. That's why I said, depending on which area you are working in, you need to provide a concept, the framework. What you are doing. Let's say you are studying in my area, for example, you are studying health insurance. You need to describe who are clients, who are the providers, who are the purchasers in the context, how they interrelate, how you are going to access information from each of these ones. So it's more like a combination of the methods you are going to use and your theoretical knowledge on the subject. So it is not similar to the literature review. And as I said, it depends on the requirement of the institution. If you are doing a lot more of the social science research, you will necessarily provide a conceptual framework. What is the difference between the terms justification, rationale, and significance? Are they interchangeable? It will be helpful for the college guide to give a description of what is expected in this section. I agree with you. We use them interchangeably, and the college can specify the justification. Why should anybody care? And it's similar to the rationale. Why am I doing what I'm doing? So it is important we really specify for our students so that you won't see in the same proposal justification, rationale, significance. And they try to put elements under each of these. So I think that is a key consideration we will take so that we indicate. You can say justification or rationale, and then we guide the student on this one. So can both research questions and hypotheses be stated in the same proposal? Yes, it is acceptable. You can answer questions and then move on to test your hypothesis. But in this case, it means you are doing some analysis. You are conducting some analytical aspect of the thing to be able to determine relationships and associations. And then your method should describe how the hypothesis is going to be tested. But it is not always every time you state research questions. If you are doing a pure cross-sectional study and you state your research questions, that should be fair enough and good enough. Can you state hypothesis for an analytical cross-sectional study? I will say yes, because we are conducting an analysis. We have cross-sectional studies, but we are able to do some analysis and indicate some associations. You see that this risk or this observation was high among this group. We can do that. Should you include lack of consent as an exclusion criteria? We always see that you are not excluding the person. The person is refusing to participate, so he's not involved in the study in any way. So I will suggest that you don't have to state that those who refuse consent are excluded. Of course, if you refuse consent, why will you include them? They have refused. So that's how I see it. So lack of providing consent, they are not engaging and they are not taking part. So you are not excluding them. They have excluded themselves from the study. But that's why it is important to make our sample selection as probabilistic as possible. Otherwise, we may have difficulties. I can give a clear example. You are conducting a survey among outpatients and say, oh, you are studying depression among outpatients in a teaching hospital. And then you select your sample. But all those who are quiet, who have their affects planted, are refusing to participate. And you only recruit those who are smiling at you, who are welcoming you, you include them. At the end of the day, you will say that the prevalence of depression among outpatients was so and so. In fact, it is not true because there was a selection bias. So we need to be mindful about how many people are not giving consent. Is that a systematic thing that goes through? Then that is problematic. So we need to be careful. So it is not just exclude everybody who refuses to consent. That might lead to a selection bias and your results may be problematic. So we need to be careful, mindful of that. Why are people refusing to? Are they all having a certain criteria? And then that becomes systematic, and that is a problem, and you need to look at it. If you are doing something and all males are refusing to consent, and you get only females, then there is a problem. So we need to be careful of that. And then the camera and the video analogy. All right, the camera tends to describe what is happening at a particular time. It takes a shot and describe a time freeze, what was happening at that time. That is what most of the descriptive studies do. A cross-sectional study typically will describe what is prevailing at the point. I wanted to highlight that time element is not always what is used to determine whether a study is a cross-sectional study or a prospective study. You can do conduct a cross-sectional study over 1 year, over 6 months. For example, you are doing something with Burkitt's lymphoma. You see the mother, you examine the baby, you take all your information. That is all. There is no follow-up. You don't see the mother again. However, you don't get all the Burkitt's lymphoma at one clinic. So you continue to recruit them over a year or so. That is still a cross-sectional study. It's over an extended period. But the element is there is no follow-up. You are not going forward to follow them up. The same way a longitudinal or a cohort study does not necessarily need to be over an extensive period of time. If you are doing a post-operative assessment and you are measuring the electrolyte level every 4 hours within the first 24 hours, that is a prospective. It is not cross-sectional, even though it's within 24, because there is the follow-up element. That is important to know. Then consecutive sampling. In fact, technically, we do not, in the classical textbook, you won't see anything like consecutive sampling. What it is that we describe it. That's why it is important to describe exactly what you did and not try to fit it in a jacket. It is one of the simple random sampling techniques. You don't decide the next patient who is coming, whether it's a woman, 30 years, 40 years. So you recruit them consecutively as they come. That is there is an element of randomness there. So we say my participant will be selected consecutively. It is better than indicating consecutive sampling. If somebody wants to be strict, you ask what is consecutive sampling. I believe this helps. It doesn't mean it's wrong, but the mode you are using to select them, you are selecting them consecutively, which in fact fits more like a simple random sampling. You do not decide that the next patient who comes should be male, should be of this height, of this. They come as and when. So you recruit them consecutively as they come. I believe it helps. Cluster sampling. Yes. Let's say you are working in at the community-based level, population level, and you've entered a community. You necessarily cannot interview every person within the community. That would be a census or total enumeration or total population sampling. However, you want to select a part. What you then do is that you use natural boundaries that will reflect the nature of the community. You can use natural boundaries, borders, streets, rivers, things like that. And you say that this is cluster 1. All the houses and compounds between the main street and then the river or the Chief's Palace, things like that. And as much as possible, the cluster should reflect the characteristics of the community. It should be, if it is an old site and a new site, your cluster should include part of the old site, part of the new site. It should reflect the nature of the community. And once you've selected that cluster, then every element within that cluster is eligible. That ensures their representativeness. That's why selecting the cluster is important, that this cluster should reflect as much as possible the characteristic under study. You can also do it in the hospital setting when you want to put in groups. These are groups. This is one cluster. This is another cluster. This is another cluster. The point is that the cluster should contain elements that represent more like the target population you are studying. And then once you have introduced clustering and you select a cluster, every element within the cluster is eligible. So you do it until you obtain your sample size. Do you always have to have an exclusion criteria? No, there are some studies that you can do without necessarily having an exclusion criteria. Once you have clearly described your inclusion criteria well, and then no person with that characteristic that you have described will have another characteristic that will make them ineligible. So you always must be careful. Ensure that really this is it. Nobody else will be disqualified from this group because I have given a clear enough inclusion criteria. We are familiar with the concept of general club to critically appraise completed and published research. Is there a place for research candidates having virtual or face-to-face research club discussions on steps of planning and conducting research dissertation process? Do you facilitate such groups? It is clear there is a difference between appraising completed versus planned research. Thanks. That is a very good suggestion. And I think now that at least the good thing we have learned with the virtual aspect and mode of teaching as opposed to the frontal type of teaching, is some of these ones. We can. And I believe this can be considered by the college, like some of the discussions we had yesterday on the research clinics and things like that. So we will take this into consideration, get the college and the rector to know. And I believe in our institutions, it shouldn't be difficult to do that. Sometimes you can probably use local experts, and then if there are other areas that need specific attention, we can always ask for external support so that we can do this. I believe some departments and some institutions do that. All residents will need to come and present their final proposal for critical appraisal and before submission. So we can, yes.
Sorry, Prof, can I just clarify?
Yes, please.
Yes, this is Conrad speaking. Thank you very much for your presentation. You know, your presentation just simply highlighted everything so clear, and it occurred to me that even after so many years, as an educator, as a trainer, I have always been, you know, we are always presented with, oh, let's form a journal club and meet once a month or every 2 weeks. But the concept, the reason I asked about a research club is specifically for those who are preparing to submit proposals or preparing to submit dissertations, you know, for those particular individuals to be able to form a group. And now that people are used to the virtual environment, you know, those 1, 2, 5, 6 people who may be, you know, one person in the north, one in the western region, one in Ho, one in Kumasi, you know, it might be possible. It might be possible that they can address some of these issues about, oh, I'm thinking about doing cluster, and then the 5 of them would all give their views, you know, in a non-judgmental sort of generic sort of way. But I hadn't thought about it before until just now. But you know, there is a difference between, you know, appraising completed, you know, where you just do a checklist of checking the different aspects of the published versus the you know, so many variables when you are preparing a proposal or a dissertation draft.
Thank you, sir. I think it is very important, and we need to, maybe our training coordinators in the various institutions can look at this. Then we encourage the residents, as Conrad indicated. Then I think it will be very helpful just before they submit. Prof. Ofureji.
Hi, sorry, I joined a little bit late, but on 2 occasions, Journals Club has been mentioned, and I wanted to comment.
Yes, sir.
The Department of Medicine at Kolebu has a Journals Club that is geared, in addition to looking at work that has been done, get the residents to appreciate what goes into the research that they are reviewing. And it starts by, in September, for example, when we have a new batch. The last time we did it, it was the rector of the college who did something similar to what you're doing over a period of, I think we had about 5 or 6 sessions. And then we got a statistician also to come and explain the statistics of some of the papers that they are reviewing before the residents now start presenting. And their consultants are supposed to help them identify the paper they want to discuss. And the consultant is expected to be present at that presentation. And then they have also been given checklists to look at when they are reviewing different types of published work. It works nicely. The only part of it that does not work well is that for each presentation, the residents are supposed to appoint a rapporteur who will write up the discussion after the presentation and actually file it in the departmental office as part of the process that you start writing things up. Unfortunately, only one person has done this since 2016.
Wow.
And And I think that it's very important that, I mean, they take General's Club seriously. I thought that probably to be one of the things that the college will put in the conditions before writing your final. Because I think it's important. Through the discussion, several things come up. And it's very useful to them. And it's also very useful to the supervisors or the consultants who's sitting. As I said, for each session, we actually have this Reverend, what's his name? Professor, he's in the Department of Physiology. He's volunteered to sit in at each General's Club meeting. So if there is a difficulty in understanding the statistics used, then we call on him to explain. So he's a regular attendant at the, and so I think we should look at it seriously, because it works two ways. You get to appreciate what is going on in science and understanding what goes on. Many of the residents now, when you ask them a question, they talk about this country's guidelines, they give you the acronym of a study. But when you actually review that study, you find that some of the things that they are saying the study says is not applicable.
It's not
so applicable. I think it's a very important exercise. Thank you.
Thank you very much, sir. I think the two suggestions are very germane, and we will relay this to college to look at it, and then at the training institutions. Please explain confounding factor again. I got somewhat confused with the analogy given. All right. So confounding factors are factors that independently may affect the independent factors as well as the outcome that you are interested in. So as I indicated there with the example, if I just explain it, that alcohol, we are looking at attendance, church attendance, simplistic, and liver cancer. However, in all our consideration, we didn't consider a factor like alcohol. However, alcohol independently may influence somebody's development of liver cancer, as well as on the lighter side, as I said, people's attendance at church on the weekends, maybe because of their social habits and characteristics. That is just a simple way of saying that the alcohol may also affect or influence church attendance. So it independently affects church attendance and independently affects the liver cancer, which is the outcome. And if you are not, you don't consider this, your findings may not always be what it is, but may be spurious, depending on other factors. I believe this helps. So as much as possible, once we identify this, that is why a thorough literature review, what others have done already, is important, so that in your literature review, you get to know this. And then when deciding the questions to ask, what factors to consider, you consider all these important ones. Then you don't leave them out.
Just a small contribution before you close. I was going to mention that with the research clubs, general clubs and all that, I think faculties should learn from each other. Like Professor AJ said, some faculties have very good programs. And I'll stick my neck out for the pediatricians, for example. Excellent. They have very, very good programs that they are hosting for their residents, getting their trainers involved and all that. So I think that the faculties should begin to learn from each other, understudy the other faculties, ask questions about how people are doing their work, how they are getting their residents to go forward and all that. And as we dialogue amongst ourselves, we can work together. Conrad also mentioned the space of the internet and all these online meetings. We can join other people's programs. Other faculties may be doing something, you join, and then over time you learn, and then you start your own. So I'll encourage faculties and trainers to ask questions amongst themselves. And if you have a good program, share it with other faculties. Sometimes within Kolebu teaching us, we'll be surprised one faculty or one faculty is struggling, but another faculty is doing very well. Yet there's no interaction between the two. So let's begin to do this kind of interaction to improve upon the work of our residents. Over. Thank you.
Thank you very much, Vice Rector. We are grateful. That's a good admonition. So we will end with that, and let's try and work among ourselves, share ideas, and learn from each other. So on behalf of the Rector and the team, we are grateful for your attention and the time you spared this evening. Thank you.